Hello and welcome back. Today we're going to talk about Chapter 14, Protecting Against Infectious Disease. We're going to describe the process of infection and factors that increase or decrease your risk of serious infections. We're going to explain how your immune system protects you from a variety of different diseases. We're going to describe some common pathogens which cause disease and how antimicrobial resistance is a problem in society at the moment. And we're going to talk about prevention and control of infectious disease. So this is the epidemiologic triangle, if you will. The host is the animal or human in which the disease resides. An agent is the factor that causes disease. Typically that's viruses, bacteria, fungi or parasites. And the environment is the environment in which the host and the agent live. Typically for humans that's housing or health care settings such as hospitals. Sometimes it's travel locations or mechanisms of travel such as airplanes. We're going to talk about different routes of transmission. The most common routes of transmission are direct contact. Sometimes that is through the skin or through direct contact with bodily fluids. Sometimes that's sexual contact. There are foodborne and waterborne diseases that you can get from drinking water or eating unwashed foods or unsanitary food preparation. There's airborne illnesses. COVID-19 is mostly an airborne illness spread by droplets. There are vector-borne diseases, things that are carried in mosquitoes or fleas through bites of those vectors, those organisms. And sometimes there is transmission from mother to child, perinatally, during pregnancy. So what are some of the factors that predispose a person to infection? Too much stress is huge. A diet, poor diet. You can improve the functioning of your immune system by eating a diet high in fruits and vegetables and whole grains. Fitness, aerobic fitness and strength contribute to improving your immune system. So low fitness predisposes you to illness. Lack of sleep predisposes you to illness. Use of illegal drugs or even misuse of pharmaceuticals prescribed by doctors can lead to diminished immune responses and more illness. Poor personal hygiene, things like not washing hands is a risk factor. And there are high-risk behaviors such as unprotected sex with multiple partners that predispose to certain types of infection. The key here is to look after your immune system and not to engage in risky behaviors, but to look after your immune system in your body. Some things that you can't modify, some non-modifiable risk factors, hereditary. Some people have less active immune systems than others and may be more likely to develop disease. Age. As we age, our immune systems become a little weaker, and that predisposes to illnesses. Environmental conditions, living in dirty environments, unclean environments predispose to disease. And the organism itself, we don't control the organism. If an organism develops high virulence, that means it will infect lots of people, causing harm or indeed resistance to antibiotics or something like that. That again is a factor that we cannot modify. So what are your body's defenses? Your body has a number of different active defenses against infection. First of all, there is physical defense. Physical defense, things like your skin. Intact skin is a very effective barrier to infection. Then there's the immune system. There are different branches of the immune system that function to protect you. First of all, there's the innate immune system, which consists of cells called monocytes and macrophages. These are types of white blood cells that engulf or phagocytose or eat a variety of different microorganisms that are trying to invade your body. Then there's a humoral immune system. This is the part of the immune system that generates antibodies. Antibodies are proteins that are made specifically by your body to neutralize or inactivate things like viruses or bacteria that are invading your body. You can activate humoral immunity by vaccinating. And then there's cell-mediated immunity, which consists mostly of T cells and NK cells. These cells help B cells to provide antibodies, and they also directly attack invading organisms. Unfortunately, the immune system is not perfect and it can go wrong. When it does go wrong, you'll see things like autoimmune diseases occur. Some of those autoimmune diseases are things like inflammatory bowel disease or systemic lupus erythematosus. These autoimmune disorders, multiple sclerosis, these autoimmune disorders are where parts of the immune system, either the humoral B cell antibody mediated system or the T cell system, or indeed some monocytes and macrophages, start to attack normal parts of the human body, causing disease. Fortunately, autoimmune diseases are rather rare, but and for the most part treatable, but they can cause very serious disease. The most important thing we can do to defend our bodies against invading organisms is vaccination. Let's take a look at the body's defenses against disease-causing pathogens. The skin provides a physical barrier with a particularly acidic pH in sweat gland oil secretions that prevent bacterial infection. Tears are filled with antimicrobial enzymes like lysozyme that kill many bacteria. Saliva can wash away microbes from teeth. The respiratory tract has fibers, hairs, which clear out microbes, sweeping them out and off the lung surfaces. The stomach is full of acid. Acid kills pathogens on their way into the body. The large intestine is filled with helpful bacteria that we like to call the microbiome. And the microbiome specifically protects against invading organisms that cause disease by harboring and supporting the growth of healthy bacteria that protect. And the urinary tract is another way for the body to wash away and eliminate microbes. So why are vaccines awesome? Vaccines consist of generally some part of a microorganism, usually either a dead microorganism or an attenuated microorganism, or just a molecular protein or part, just a tiny piece of a microorganism that causes disease. This part of the microorganism induces your immune system, both the humoral, that's the B cell antibody mediated branch of your immune system, and your T cell, that's the cell mediated branch of your immune system, to be ready to respond when your body is attacked by either the virus or a bacterium that the antibody, the vaccine, is protecting against. So vaccines are the most effective mechanism by which we can protect ourselves and our community. Think of vaccination not only protecting yourself, but protecting the vulnerable members of the community that surround you. People like grandparents or the elderly or children or babies that may not yet have very active immune systems, or the elderly whose immune systems may be compromised by age. You can help protect them from disease by getting vaccinated, as well as protecting yourself. Here's a list of recommended adult immunizations by different age groups. You can see that it's recommended to get things like the flu vaccine yearly. That's because the flu is a dynamic virus that changes every year, and there are usually 3 or 4 variants of flu at any one time traveling around the world. Tetanus, diphtheria, pertussis, these are bacteria that there are very effective immune vaccines for. There's measles, mumps, and rubella vaccination. Very important to get that. The measles has been virtually eliminated by the measles, mumps, and rubella vaccination. There are other vaccines here. Let's take a look. The HPV vaccine is a very interesting new vaccination which prevents human papillomavirus, which is a sexually transmitted virus that causes cancer, causes cervical cancer. Vaccination with HPV virtually eliminates cervical cancer. Very effective vaccine. Both men and women should get that vaccination. Hepatitis are viruses that attack the liver. Important to get those vaccinations. Meningitis is a virus that's quite common. Meningitis infections are rather common in college students. Again, that's an important one to get. Here are some bacterial pathogens that cause disease. Staphylococcus, Clostridium difficile, Streptococcus, meningitis, pneumonia, tuberculosis. There are some tick-borne bacterial diseases, and E. coli, particularly O157 strain of E. coli, which is found on uncooked meats or poorly cooked meats, can be very dangerous. One of the most recent concerns to come to light is antibiotic resistance amongst these bacterial infections. Antibiotic resistance is thought to occur for a number of different reasons. One of the reasons is overuse of antibiotics in farming. Overuse of antibiotics in farming can result in bacteria that are resistant to those antibiotics, and they can pass that resistance onto other more pathogenic bacteria. Antibiotic resistance also occurs in medical facilities, and people can acquire infections in medical facilities if they are not clean. And those infections, if they are antibiotic resistant, are very difficult to treat. Some common viral pathogens include the common cold or rhinovirus, influenza, there's infectious mononucleosis, hepatitis virus, mumps virus, Zika, herpes viruses, measles virus. The measles virus also causes shingles, which is reactivation of the measles virus. Once you've had the measles, it's in your it remains in your nerve endings for life and can be reactivated if your immune system is ever compromised, causing a disease called shingles. If you have had measles in your youth, you should definitely get the shingles vaccination later in life to prevent a reactivation of the measles virus. Very painful condition, shingles. Otherwise, you should always get a measles vaccination when you're young. And rabies is a particularly dangerous disease. Occurs in the wild. If you get bitten by a rabid animal, a rabid dog perhaps, rabies can cause death. In fact, it causes death in about 90% of cases. So making sure you get treated after animal bites is essential. The common cold. Common colds are endemic. That means that they live in the society year-round, although you'll see their prevalence increase during winter. You do not catch the common cold from being cold. You catch the common cold because it's a virus. It's often spread through schools. About 5 to 20% of Americans will get the flu each year. There are usually 3 or 4 major varieties of flu at any one time, and the flu vaccination is currently a quadrivalent vaccination. That means it treats against 4 different varieties of flu. But it does not protect against every single type of flu that might occur. So even with a flu vaccination, occasionally people will get sick with flu virus. People who should definitely be vaccinated against flu are seniors, anyone that is thinking of becoming pregnant or is pregnant, people with certain autoimmune diseases, particularly those affecting the function of their heart and lungs, should always be vaccinated. And in fact, if you know any person that is in these categories, you should be vaccinated as well to protect them from any infection that you might acquire. There are some other pathogens that are seen, particularly in hospital settings, things like fungal infections, protozoan infections. In some countries, parasitic worms are problematic, and prions are a rare but concerning new kind of pathogenic disease.